Well, good evening, everybody. Welcome, welcome, welcome to Everyday Equity with Dr. Matisa Wilbon. It is Thursday night. It's 8 o'clock, and here we are again with another wonderful episode. Thank you, thank you, thank you for all of you all who are joining. I'm super excited about tonight, about our conversation, about my guest. Now, I'm using a different method. I'm using my phone instead of my computer, so I can't see everybody's comments. But do me a favor, as you're joining, tell me where you're joining from, and just let me know that you're there. There we go. I knew it was you, Mari. I knew it was you. I missed you too. We have been gone for the last little bit. I had to take a couple of weeks of break, and it was the holiday season and all of that. But here we are back. We have a fresh new topic, and I'm super excited about this again because I think equity is such an important conversation, and I'm glad that you're willing to share at least part of your Thursday evening with me, with us, as we talk tonight. Now, I'm not going to spend a whole lot of time because we have got a very special guest tonight. Again, I'm super excited to be able to introduce her. But before I do, I want you to do me a favor and go ahead and share this live. We are on LinkedIn. We are on my Facebook page. We are also, hey, Andrea, good to see you. I'm so glad that you're on. We're also on my YouTube page. So I'm so glad again to see everybody joining. Do me a favor, go ahead and like, share. Make sure that you set your notifications for every Thursday night at 8 p.m. EST for Everyday Equity. What is Everyday Equity? This is the opportunity for us to have a conversation about issues related to equity, making sure that there's fairness and resources and opportunities for all. We have talked over the weeks about a number of different things. We've talked about equity as it relates to the legal system. We've talked about equity in terms of the education system. We've done a couple of sessions on that, but tonight we're talking specifically about health equity. I posed these questions for us to think about even before we started tonight. And I'll pose these questions again. I want you to think about people that you know. How many people do you know who don't go to the doctor very often because they don't have health insurance? Or they don't go to the doctor as often as they need to because they don't have the money to pay the copays? How many of you all have people within your families? I know I do. People within my family who don't do preventative care. They don't go unless there's a really big problem. And that problem has to be really bad for them to actually go to the doctor because they don't have access to healthcare. How many go and the healthcare isn't that great, and so things are missed, right? We know when the pandemic happened in 2020, we know that there were so many people who were negatively impacted because of distrust, because of the healthcare system, because they didn't have access. They sort of didn't know what to do, lack of information, lack of awareness. What I want to say tonight, and our expert, Dr. Hume, is going to be able to talk about this much better than me. But I want us to think about what that means for our communities, our churches, our families, our society. We know that health is a booming business right now. It's been booming, big pharma. We know that there are people who are cashing in on the fact that we are a really sick nation, even though we are one of the wealthiest. So what is it that we need to know? What do we need to be aware of, right, as a large community? And then what is it that we can do to make sure that everybody has the best chance to live the healthiest life? So we're going to talk about some of the challenges, some of the things that we need to be aware of, but then we'll also talk about some things that we can do. Remember, this is everyday equity, this idea that all of us have a part to play. All right. So I'm excited. I'm going to bring our guest on. She is waiting patiently by the in the wings, I should say. Now tell me, Dr. Hume, are you there? I'm going to make sure your camera's on and all that good stuff, and we're ready. And as Dr. Hume is getting ready, I'm going to bring her on now. I'm going to talk about her just a little bit. And is your camera on, Jessica?
It is.
Okay. Oh, there we go. It was dark for a minute, but let there be light.
Hello.
Can you hear me?
Hello, hello.
Oh, okay. It's cool. This always happened. Can you hear me now?
Yep.
Oh, good, good, good. I was going to say we test all of this before we come on, and then of course it's when we come on that things start to mess up. So that's the way it works. So for those of you all who don't know, and probably everybody does not, Jessica and I worked together at Bellarmine University. She's still there.
Mhm.
That was my first teaching job, a place that's got phenomenal memories for me. And our paths crossed in a number of different ways.
Mhm.
Um, I don't think you were in your current position at the time.
That's
Is
right.
that right? Yeah,
Yeah, I
that's
had
what I thought.
changed roles. Yeah.
Yeah. But I'm super excited because, and you can tell us a little bit more about yourself, but specifically, I know you deal with public health. So
hmm
do me a favor, just introduce yourself to the group and then we'll get started.
Sure. So can everybody hear me okay? Any issues with that? Okay.
If let us
So
know in the comments if you can't hear us, guys.
yeah.
Okay.
And everybody, please feel free to throw out questions. If, I say something that brings up a question for you or anything like that, jump right in. I'm happy to answer questions. So I am Jessica Hume. I grew up in Louisville, Kentucky, and I am still here. I still work in Louisville, and I live in a small town called Lawrenceburg, just outside of Louisville. I'm currently an associate professor at Bellarmine, but I started my academic career as an English major at Bellarmine, and went on to get a master's degree in poetry. So I came to this position through kind of a circuitous route. I started teaching English at Bellarmine for students in the health sciences. And then I decided to go back and get my PhD, and I specialized in a field called health humanities. So that is a field that is growing in popularity and closely related to public health.
Mm-hmm.
But what health humanities does is take advantage of those humanities topics. So literature, storytelling, religion, faith, ethics, pop culture, and bring all of those to bear, along with some strands of public health and psychology, on how we think about health and healthcare. And the idea is to humanize it a little more, right? To bring the care back to healthcare.
Mm-hmm.
And so that is how I came to the discussion of equity. And so after working with the English department for a long time, and then growing my passion for health and this interdisciplinary conversation about health, I moved departments to the Department of Healthcare Administration and Public Health. And I have to give a little shout out, Matisa, because I saw the poster, the ad that you put up earlier, and it had that amazing quote from MLK on it. And these are our department T-shirts, which I had to wear for an event at school today. And
Uh-huh.
I won't reposition for you all to see it, but we have that same quote printed on the back.
Nice.
Yeah, so that was a perfect choice that really
Yeah.
resonated with me. So yeah, health equity is really, really, really important to us. And for me, I think the biggest thing that we talk about a lot, and I don't want to jump the gun, but is the environment people live in and what we
Yeah.
call the social determinants of health, right?
Yeah.
Those
Yeah.
factors that don't have to do with our biology and our
Mm-hmm.
genetics that affect our health in really huge ways. And
Mm-hmm.
so that's hopefully one of the things I'll get to dig into.
Yes, I'm so glad. So we'll definitely segue into that.
Yeah,
Um, so I have two questions.
sure.
One is I always start off by asking people outside of, kind of telling us about yourself. I want to know, first of all, kind of what your equity story is, right? Most people get into this work because some aspect of equity has impacted them personally or someone
Mhm.
perhaps that they know. We all have sort of a story, right? So that's the first thing. And then the second thing is I'm really interested because I was actually telling my daughter, maybe it was my son, I was like, yeah, Jessica and I, we work together. No, it was my husband. We work together with the living learning communities and our paths cross in other areas. And I remember English. I remember
Yep.
that, but I didn't know the transition. I think you say health in the humanities. What's it
Yep.
called?
Health humanities is the field. It's
Health
also
humanities.
known as medical humanities. Yes.
Okay. That's new for me. I think it's fantastic. I'm just curious why you went into that area. So if you could talk about those two things.
Yeah, sure. So for me, it was actually a natural path from creative writing. I wrote a lot about bodies and about people's struggle with illness.
Hmm.
I come from a background, and I have no issue in disclosing this, and I want to destigmatize. Right, I was diagnosed with depression and anxiety at 13, and had a lot of interaction with the mental health care system.
Hmm.
And then I'm recently diagnosed with ADHD. So I'm a late in life ADHD woman trying to navigate that,
Hmm.
and PTSD. And so for me, it's been navigating that system. And then of course for any female identifying person who's ever birthed a child, that
Hmm.
experience is a whole journey in healthcare education, right?
Hmm.
Very revelatory. So those two kind of things are where that's where my experience comes from, in areas of health inequity or challenge, I guess. And
Hmm.
for me, it's often about language. It's often about the conversations that we have with providers, those individual experiences. And that comes back to the storytelling. We all have, and so you kind of brought us to this, Matisa, right? We all have those stories
Hmm.
about our experiences, and
Hmm.
we all tell stories out of humanity, right? We are the only species on the planet that tells stories. And
Yeah.
that's how we communicate, and that's how we um, express care and concern and relationships with each other.
Hmm.
And so those stories of our health and our well-being create our identity. They create who we are. And if we don't have those acknowledged and respected and borne witness to by our community and the people who care about us, then we suffer emotional pain, but also struggle to sort of put our identities back together in the wake of serious illness or trauma. And so
Hmm.
my particular field of interest is those stories of health. So when we talk about public health, we look at statistics and data, and that tells us what the challenges or problems are.
Hmm.
And my field, looking at stories, tells us, paints the picture of those
Hmm.
challenges, right? So we get the stats and we know the science, but what are the people stories behind those experiences, and how can we bring those to healthcare to create better outcomes for people and for care providers, right? How do we
Hmm.
build trust to make those things happen?
So I'm so excited. Okay, so I was already excited about this conversation, but I'm even more excited now
Good.
because you're speaking my language.
Yes.
But as you were talking, Jessica, one of the things that made me think about is recently I went to the doctor. I have really bad allergies.
Hmm.
Excuse me, and I went to the doctor, and there were a couple of other things that I had my iPhone out because they tell you make sure you write down how you're feeling, and then you could take it to your doctor. So I had all of these things there, and so while I went to talk about my sinuses, I was also going to talk about ABC because I don't go to the doctor much, right? I do my checkups and all of that, but I wanted to just make sure that these symptoms that I was having, that I was at least telling my provider. And it was so interesting. I'm educated, right? I do preventative care. I
Hmm.
can maneuver systems for the most part, right? That's not my area, but I can maneuver. And I go to the doctor, and she was, okay, let's do this. Let's do this. And I remember leaving, looking at my phone like, oh, wait a minute. I didn't talk about this, and this. So now
Hmm.
I'm like, okay, do I go to my portal and message the people? Do I call back? Because I know I'm not going to talk to her directly.
Right.
So my point in saying that is you just made me think about how something that is so necessary and important for all of us, those stories do matter. My
Hmm.
story is I'm in relatively good health, but I wasn't able to communicate with a doctor satisfactorily, right? I didn't walk away thinking, and I'm sure she was super busy, so it's not personal, but I walked away thinking, wow, I don't feel like I was 100% cared for. What might that look like for someone who doesn't have the language?
Right.
or the experience or the ability to navigate. And that's just one story,
Yeah.
right? Out of many.
And often I find, so when I have these conversations with people, I sometimes do a poll of the room and I'll say, you know, like, how many of you can identify a time where you interacted with a healthcare provider and you felt unheard or powerless, or like you left with questions, or worse, that you left feeling less helped than when you walked
Mhm,
in, right?
mhm,
And I don't mean to vilify healthcare providers, because the biggest percentage of them are incredible people that there's a special place in heaven for, working in a system that is very, very broken, right?
yeah, yes.
And so those individual interactions, we know there's so much evidence-based research to show that trust between a patient and care provider leads to improved adherence to treatment. Those people that trust their providers and feel that positive relationship
Mhm,
will take their medicine more often. They will do what their provider tells them, even if it doesn't feel good, right? Like physical therapy is a pain sometimes.
mhm,
And that results in better outcomes for those people. And it also, on the other end, results in making those care providers feel more fulfilled about their jobs. So creating those relationships in healthcare has a lot of power.
mhm.
And I think the most compelling thing for me is that it has a lot of power to improve our lives, but also the bottom line. And yet we don't see a lot of movement on it.
Mm.
But I don't want to get carried away on my soapbox. I want to stay focused here on the health equity piece. So,
Yeah,
um, yeah,
but
where should
I
where should we
think
go next?
no, I do think that's an important conversation because I can imagine a lot of our listeners, a lot of our audience, particularly on my Facebook page, are people again from all walks of life,
Hmm.
and I can imagine that feeling like you've gotten good service or not, good care or not, is a big part of, as you said, those ultimate outcomes. So I think that's an
Hmm.
important part of the conversation. I do want to switch gears though, kind of go back to the beginning.
Hmm.
And I see some folks on. Latasha, thank you. I'm so glad that you're here. Do me a favor and go ahead and share and comment and let some folks know that we're on. But when people think of health, you people do think probably most often genetics,
Hmm.
DNA, biology. So talk about those social determinants as you kind of referenced earlier of health and how we've gotten to where we are.
Yeah. So, for folks who don't know, what we call the social determinants of health are basically the factors in your life, aside from your biology, your physical biology and genetics, that affect your health and well-being. So it can be the family environment that you're around, your support system or challenges to that support. It's diet, it's access, right? Access is huge, a huge factor in diet, and healthcare. It's environment. So here in Louisville, for example, we have a big disparity in health between what is our west end and what is sort of our northeast end. And
Mhm,
much of that has to do with the environment. As a matter of fact, so here in Louisville, we have a lot of green space in a few specific areas of town that were designed by Frederick Law Olmsted, who's the same person that designed Central Park in New York
mhm,
City. And
mhm,
it's beautiful. And it's all in very affluent areas of town. And in the west end of Louisville, what we have is far fewer trees. And so in the warmer seasons, it gets much significantly warmer, measurably warmer in that area. And this happens in a lot of big cities. Louisville is not unique. But what that means is that our young folk, really young folks and really old folks in those communities are much more likely to suffer from respiratory illness, and they are
mhm,
much further from hospital care. So
mhm,
it takes them longer to get to a clinic or a hospital if they have a respiratory illness. We also see huge spikes in community violence when it's hot, right? We see lots of other health issues activated in the heat. And that's just one example, right, in which that change in one part of town, that environment, creates a massive change in health and well-being for those folks. And there are other parts of town, as many people here, I'm sure, can identify with in their hometowns, there are places where there are factories and there's a lot of smoke. We have evidence that that's causing health issues for folks in those areas and has been for some time. And that affects their health and well-being. In fact, in Louisville, I'm embarrassed to say often that Louisville is well known for bourbon, horses, and health disparity. In fact, there was a series, a program on PBS that they did a series on health disparities in the cities where it is the most pressing in the country, and Louisville was the first episode, and that was over a decade ago.
I just used that for my sociology class.
Yep.
A natural causes is what it's called.
Yes, thank you. Yes. And it is a great depiction. But we know that this is happening in big cities all over the country, right? It's not just Louisville. So there's Memphis, Atlanta, similar disparities. But here in Louisville, the life expectancy between the West End, the heart of the West End, and the northeast side of the city is about 10 years.
Oh, and I didn't realize it was that much.
It's about 10 years, according to the most recent Louisville Health Equity Report, which was about 2017. It's roughly 10 years. And another one that I've been talking about with people a lot recently is maternal and infant mortality, because that is a huge, huge concern in Kentucky and all over the country and all nationally. Black and brown families suffer this disparity a lot more significantly. We are losing infants and mothers all over the country, in some places, including Kentucky, at twice the rate of Euro-descended folks. And that is shocking. And Kentucky...
I'm sorry, I didn't mean to interrupt you.
Okay, go ahead.
Tell me what that, so I do want to pause for a moment because I think this is huge. As you all are watching, taking notes, again, let people know that we're on, because I think this is so important. I think it's intuitive that factories and smoke and those kinds of things, I think that's intuitive. I think the green space conversation isn't as intuitive for people, probably, that, your proximity to green space can make that much difference. And now you're talking about, which we've seen even more on the news, and they're sort of high profile people. I think of Serena Williams. I think of Judge Hatchett, who's a famous. Yeah. Yes.
Yep. Beyonce spoke out about this. Yeah.
Yep. Beyonce. Judge Hatchett, who was a prominent television judge. Her daughter, I think it's either her daughter or daughter-in-law, died in childbirth. And her son now is, sort of beating the drum to talk about this in terms of maternal mortality. But my question to you is going to be, why is that? Why do we see infant mortality and maternal mortality being higher among Black and brown families?
That's a fantastic question. And the answer is multifactorial, right? Okay. It can be and that means in different cities, it's different things to different extents. And so it can be access, right? And it can be insurance. So many women who don't have great insurance coverage or have no insurance coverage don't get the prenatal care they need. And they're not able to, and they don't have access to it. In some areas, we have rural populations that are like they're 2 hours from access. I think somewhere, I want to say in Atlanta, near Atlanta recently, there was a hospital that shut down. Another hospital, I saw an article about this, a couple of hospitals shut down in the South. And that meant that access is going to be diminished for a few communities. And so we're seeing that in rural areas too. Access is an issue. It can be about food access. So access to nutrition. In fact, I had an honor student who did a project analyzing that in several major cities this past year. Is there kind of an association between what we used to call food deserts and now we're calling food apartheids? Is there an association between those areas and rates of maternal and infant mortality? And then, of course, there are the more what I call overt or direct influences, which is changes in treatment that those families may encounter in their actual treatment, right? So we know that there are times when Black and brown folks are in the system, in the healthcare system, and receive different treatment, or different surgical recommendations, or delayed treatment, or are made to wait longer for
Mm-hmm.
treatment.
Mm-hmm.
We know that those things happen, and so there is some of that as well. And
Yeah.
there are embedded biases that often can affect those things. So, for example, and this one's not about maternal mortality, but there is a mythology that still circulates in medical schools as part of a sort of unspoken curriculum that Black men have thicker skin than white men, and therefore larger or sharper needles should be used. And I know
Mm.
doctors who still heard this in medical school in the 80s. And so this is still floating around as sort of anecdotal information. And it's
Mhm.
those kind of things that get circulated that then lead to this mythological information or
Mhm.
biases that then manifest in poorly executed treatment,
Mhm.
unfortunately.
Mhm.
There is a wonderful, absolutely gutting documentary about this on Hulu, if anyone is interested, called Aftershock, that tells
Mm.
the personal story of a woman who had an experience like that, who was fairly educated, had what we would consider a person that kind of had their stuff together, right? Like
Mhm.
had her prenatal care, had um, a fairly strong level of socioeconomic status, and was doing all the right things, and
Mhm.
and developed a concern and brought it to healthcare providers, and was turned away and told, oh, it's just whatever, right?
Mhm.
And unfortunately lost her life.
Wow.
And so the reason I was thinking about this, Matisa, looking at the title of this episode, what is health equity and why does it matter? Why does it
Mhm.
matter to everyone on the planet? Is that maternal and infant mortality is one of the major signifiers of our health overall. If our
Mhm.
maternal and infant mortality is poor, that tells us that we have major issues on our hands, in
Mhm.
addition to the fact that we are losing all of those people, right?
Mhm.
So
Mhm.
this is a major red flag. And I really, I don't want to this is a huge issue, and I don't want to understate it. I don't want to scare people, but it's really important because here in the US, we have some of the most, as you mentioned at the beginning, the most resources of developed nations all over the world, and some of the
Mhm.
worst health status.
Mhm.
And here in Kentucky, within that country, our state in Kentucky, I mean, we've got folks from all over the place, but in Kentucky, we have some of the worst health. It's between 48 to 50. And our maternal and infant mortality usually ranks between 48 and 49. It's one of the worst, if not the worst, in the country. So where I live is the worst, period, almost.
Mhm. Mhm.
Um, and it is twice the infant mortality rate for African American and Black families in Kentucky is twice that of white families,
Mhm.
and
Mhm.
that is shocking. And
Mhm.
there are preventable factors. That's my point, right? There's preventable
Yes.
factors
Well, and
that
I
we
want to.
could
I
be
want to.
making changes on.
That's exactly where I wanted to go. I wanted to ask you, were there any more? Because, we want to talk about why it matters and what we can do.
Hmm.
Um, so, in terms of the social determinants, you mentioned green space, you mentioned access, you
Hmm.
mentioned, climate and pollution, those kinds of things. What are
Hmm.
other big social determinants that we should know? I think you talked about food as well. What are
Hmm.
some other things?
Oh, let's see. Support systems. So family support system, who we surround ourselves with, who we choose to be around, that makes a huge difference. We know, not just our immediate family that we live with, but the people that we are around. Friendships. Recently, a public health study that just came out this week, I love this. It
Mhm.
showed that people who have strong friendships tend to live a lot longer.
Mhm.
Loneliness is the new public health emergency, and it's huge, and it leads to real health
Mhm.
problems, and it increases suicide rates. So just being social, being out with friends, taking care of yourself in that way is a simple thing that
Mhm.
people can do. So creating that support network and activating it.
Mm.
So it's about those relationships around you, the environment around you. Education is a big one.
Mhm. Mhm.
That's part of social determinants. And, advantages or access to education differs, and that's unfortunate. And so one of the things that we can do is become our own advocates.
Mhm.
I say this a lot, and we shouldn't have to be. We should have a healthcare system that advocates for us, that we can navigate properly. We
Mhm.
don't, though. And you said this, Matisa, right? Like you and I both have high level degrees, and if we walk out of a doctor's appointment not understanding something or not getting what we need because we got overwhelmed or we missed something, how must it feel to other folks?
Mhm.
And that shouldn't be. That
Yeah.
I shouldn't need any kind of advanced degree to understand my doctor, right? So becoming advocates for ourselves and our families and educating ourselves is a factor, something we can do to affect those social determinants.
That's so good, and so that was going to take me to my next question. And you've kind of mentioned, you kind of talked and touched on some of it. We started out by talking about the fact that a lot of these social determinants that you've mentioned are external to the individual, right? So we
Hmm.
started out by saying you think health is about biology and genetics and DNA only, but
Hmm.
really there are these things external to us, some things that we can't control at all, things that
Hmm.
aren't necessarily choices that we've made.
Hmm.
Um, so my question is, when people are thinking about this, how much needs to be changed by individuals and how much need to be changed, at this macro level, right? In terms of
Yeah.
the social structure.
Yes. And I missed the biggest one, of course, probably the most influential one of the social determinants is socioeconomic status, right? How
Mhm.
much money we have goes a long way in determining how healthy we are,
Mhm.
unfortunately. So, and we know that that's almost a direct correlation. A lot of research has shown that the more education we have and the more money we have, the better our health tends to be. So that's socioeconomic status is a big one. How much are we individually accountable is a challenging question to answer, but there are public health experts that would argue now that the social determinants make a much bigger difference, right?
Hmm.
They contribute
Mhm.
to like 70 to 80% of our well-being,
Mhm.
than our biological and genetic factors.
Mhm.
And part of that to consider is that we have biological and genetic elements, right, that are embedded in us, but many of them are only triggered by certain things in the external world,
Mhm.
right? So there are many of us walking around with certain genetic things embedded in us that may not ever have those illnesses triggered. And other folks may have the exact same thing, and living in a certain area, encountering a certain chemical triggers that,
Mhm.
right? So I think arguably those external factors are much, much bigger, at least at this point in our history, in our human history,
Mhm.
than anything else. And I think that's important for everyone to remember because it boosts, it should, I hope, boost our compassion level quite a bit, right?
Mhm. Mhm.
And remove some judgment that we tend to put on folks. Right, there are a lot of assumptions that get made about access and what people should be doing to take care of their health.
Mhm.
But if you live in an area that has a food apartheid and you don't have access to fresh produce without taking a 2.5 hour bus ride,
Mhm.
your diet is going to be affected by that.
Absolutely.
And yeah, and if you have poor insurance, then odds are your health is going to be affected by that. You're probably going to wait, as you mentioned earlier, you're going to wait longer. And when you go to the
Mhm.
doctor, you're probably going to have to go to the ER instead of the doctor, which is going to
Mhm.
cost you more. It's
Mhm.
it's it's probably going to result in more drastic treatment for the patient. So that's not ideal either.
Right.
But people can't afford to pay out of pocket for a lot of these health insurance gaps in
Mhm.
coverage. So
No, and I think that's so important. And I think, you've said so many good. I'm hopeful that we're all sort of just taking in and really thinking about, because when we think about health equity or health inequity, it matters to us all.
right.
Even if I'm the healthiest person with the best insurance and all of that, having I look at this like I'm seeing this through the lens of my neighbor, right? I look at
Mhm.
people that I'm connected to in community, in school, in my like those are my neighbors. When my
Right.
neighbors are not healthy, it impacts everything else around us. And I don't
Mhm.
think that everybody realizes that. It's so
Mhm.
easy to make judgments about what people should or should not be doing.
Mhm.
Hopefully this is educating people to see that it's not just about that. Often those individual choices are conditioned or contextualized by where they live, but that also this is impacting us all, right?
Yeah.
So talk about that for me, if you don't mind.
Sure. Yeah. So there's a like sort of t-shirt poster meme that I've seen floating around that I think really applies to health equity, and it says equity is not a zero sum game. Just because somebody else gets more doesn't mean you get less. It's not pie, right?
Yeah, I've seen
So
that.
it's
Hmm.
not pie. And
Hmm.
health equity is exactly that. The healthier your neighbors are, the healthier you're going to be. This is probably the most um the issue where if we say the high tide raises all boats, where that
Hmm.
expression applies the most strongly of anything I've ever thought of before. If we can make everybody healthier, then we're all going to keep getting healthier, right?
Hmm.
Because so much of what we the health issues that we encounter are contagious, right? We can spread illnesses, but that's the kind of direct way that we think about. But then also we have limited resources, right, in our country right now, and that's truly unfortunate. But when we are in a position where folks are having to wait and go to the ER instead of being able to get preventive treatment,
Hmm.
which is cheaper for the system, benefits them, takes better care of them, right? We know that's all scientifically established. But they can't afford that. And so then going to the ER places a larger burden on the system. And then for folks who have maybe gone to the ER for something recently and gone, why am I sitting here for 6 hours? It's supposed to be an emergency room. I have an emergency. It's
Hmm.
because emergency rooms are overwhelmed by folks who had no other choice, right? They
Yes.
couldn't choose preventive care.
Hmm.
And now they're in a position where if they don't get treatment, something really, really bad is going to happen.
Hmm.
So the more we can encourage people to get preventive care, and the more we can advocate for insurance coverage that allows that and policies that support that, the
Hmm.
healthier we're all going to be.
Hmm.
So even if folks have primo health insurance coverage, that doesn't guarantee that they're going to have great health, because we live in a network, right? We're not a vacuum. Humans
Hmm.
are connected to one another.
Hmm.
So,
That's so good. The other thing you were making me think about, I have a client that I'm working with who they're actually chaplains, but they work in an inner city at a hospital. And so
mhm,
the work that I'm doing with them is taking them through some training as it relates to health equity and racial
mhm,
inequity, right?
yeah,
So how those things intersect with their spiritual care. Because
mhm,
obviously, as you suggest, healthcare, that's not in a vacuum, right? We're individuals, and so there are all of these other factors,
mhm,
that we could bring in that intersect with the healthcare itself. And so that's why I think this heightened awareness is important, that it's not just about, the research, and all of those things are important, but that's why I love what you do, because these stories are the
mhm,
things that really help us have empathy and
mhm,
connect to individuals, So it makes us better neighbors and family members and teachers and, fill in the blank.
Yeah. And so I just told this story to a bunch of high schoolers who visited campus today, but there's a great example of this that happened here in Louisville. So when the first round of COVID-19 vaccines came out, so the very first round, first shot for everybody,
Mm-hmm.
and we had introduced vaccine clinics all over the city. And if you looked at like a map of the city, what you would see again is a gap in the west end of the city where there weren't clinics, right? And so me and some other folks had looked at this and kind of analyzed this, and a lot of people in the health departments, the health sciences at Bellarmine, had talked about it at the time. And people started pointing out to the powers that be that there
Mm-hmm.
wasn't as much availability. And what then the folks in Frankfurt started to notice was that there was a massive disparity between white and Euro descended folks who were getting the vaccine and people of color who were not.
Mm-hmm.
And they wondered why, and people began to ask, and lo and behold, it's an issue of access, right? But on top of that, and it wasn't me who brought this up, but someone called to attention the issue of trust.
Oh, sure.
Right? Somebody pointed out, hey, if you're a person of color in a community in Louisville, or really any community in the US, and you know the history of our medical system,
Mm-hmm.
the Tuskegee experiments, Henrietta
Mm-hmm.
Lacks, and they go on, right?
Mm-hmm.
So there is a trust issue,
Mm-hmm.
and understandably a trust issue, right? And so the strategy that was then put in place was with churches in the West End to set up clinics in the common areas of those churches. So it solved the access problem, but it also created trust.
Mm-hmm.
Those ministers and church leaders were brought on as ambassadors to encourage people, to build
Mm-hmm.
trust. And
Mm-hmm.
those are that's just scratching the surface to me, but those are the kind of things that we need, those trust building things, those people asking the questions beyond just, well, why doesn't that group get the vaccine like they're supposed to?
Yes.
Right? Because that's an easy question to ask. And that's often when I start having these conversations with my students, they go, well, why don't they just get vaccinated? Right? And then you have to go, well, think about it. Let's look deeper. What's the real story? Right?
It's so funny. It's funny that you said that, because not funny, but I want to highlight a couple of things. I want to tell you a story about some work that I'm doing a little more. I did.
Yeah.
I love the fact that as you all, this was rolling out, somebody, sounds like a number of somebodies, noticed the disparity and wanted to get to the bottom of it. That to me is one of the whole points of why I'm doing this.
Mhm.
That if that's our lens, if that's always our lens, no matter who we are or what we're doing every day, we can incrementally and intentionally impact, right, these things that we're seeing. So, kudos to you. And I'm sure there were a number of people, even across the country, because I know that I
Oh, yeah.
definitely heard that conversation. But for those people who pointed it out, and as you suggested, looked beyond the surface to really try to understand why. You made me think about, I worked with a client in Louisville who did some work with the park system. And they were trying to bring people of color, more people of color to the park. And they, had a couple of different programs. So as I was training with them, I started talking to them about the history of parks and trees and lynching and, stories around why historically brown and black people, parks were not the safe, nice spaces where people wanted to jog and be with their families.
Yeah.
And that once you can make that connection, then there are some things that can be done that can create healing and trust and reconciliation in some ways that perhaps you wouldn't know about were you not looking beyond the surface. And that, that just reminded me of what you were talking about now in terms of building that trust. And if people aren't aware of those things that have happened, in the black community, I won't say everybody knows, but it's kind of common knowledge, right?
Yeah.
For a lot of people, generationally, there's a little bit of challenge there, but for the most part, we hear about that stuff. But if you're not part of that community, or not
Mhm.
having those conversations, it could be easy to overlook something that really is traumatic, and talking about PTSD intergenerationally and all of that. So I wanted to kind of move us, because our time is going, but this is, goodness, such a great conversation. You've talked a little bit about what you're doing, and I wanted
Mhm.
to see if there's anything else that you wanted to share in terms of what you're doing. I know you're teaching students and training them and sending them out, which is amazing. And then we'll kind of get to what others can be doing.
Yeah. So one of the things I'm doing is the rollout of the Health Humanities major at Bellarmine. And that was founded in 2021 with a National Endowment for the Humanities grant. So we're still on that
Ooh,
grant period until 2025.
very good.
And we have the first health humanities major in the state of Kentucky. And it's all over the place. I mean, it's Princeton, Yale, Baylor, on the coasts at the Ivies and stuff like that. But we've got the first one in Kentucky, first
Awesome.
4-year, first program ever, only 4-year program. Transy now has a program as well. So that's one of the things. And then our department is doing some research. Actually, the 2 public health faculty in my department are doing some really cool research on radon exposure and breast cancer. One of our department members specializes in researching Black and infant and maternal mortality rates globally, right? So this is a global challenge as well. And so that's where
Hmm.
she's looking.
Hmm.
We're also doing some research, and this is my colleagues, so coming out of our department, doing some research on kratom as a possible way to start resolving the opiate epidemic, which, as I hope folks are seeing that affects, that's affecting large swaths of rural communities, and a lot of communities all over the country now.
Yeah.
So looking at some of that, and then gosh, we've got our fingers in a lot of pies, and for some reason they've all disappeared from my head, um, for the time being. But looking for ways to, one of the things that we're doing next semester, I'm really pumped about. I'm co-teaching a class with one of our nursing faculty who specializes in community wellness. So this is a 400 level course. It's our capstone for the health humanities degree. But we're going to have students choose a community locally to research. And so their steps are going to be analyze the public health information, learn about the challenges, but also the assets of that community, because
Good.
we don't want to go into communities that have these challenges and then focus only on that and miss all the good that needs to be highlighted and the strengths that need to be capitalized on.
Hmm.
So analyze all of that data, then get to know community members, get their stories, right? So get the data, get the stories, and then come up with a plan of action. And for me, that this is really important, to be in accompaniment with that community and what they have identified as their needs, right? What we don't want is groups to go in and go, we've decided that you need this, fix it.
Right.
Here are the supplies, right? So
Yeah.
we want to work in partnership and create relationships to a community and to individuals, and use those individual stories to highlight assets and to demonstrate how we can start to resolve challenges. So I'm really pumped about teaching that class,
Hmm.
and using literature and history embedded in that class to help students get there and pick those things up about their communities. So that's the project coming in the spring that I'm really excited about.
That sounds exciting. I'm like, I wish I could take that class. It sounds so good. And
Yeah,
I've
you
loved,
might get recruited as a guest speaker. We might have to have you phone
I
in.
would, I would love it. I would love it.
Yeah.
I when I taught social problems there, I actually had students go into the community, and they worked with the community, an organization, trying to solve a problem that the community identified. And so I know community engagement is big at Bellarmine, so that's fantastic.
Yeah.
So, I was going to say too, I actually work with a research firm here, and actually doing a project in West Virginia, starting in West Virginia, but we're moving to Missouri and Kentucky, looking at the connection between opioid use and family, fathers and families. So I'm really excited about that, because it's, as you know, it's so big and it's so sweeping, particularly in Appalachia. And being from Hazard, I'm a Hazard girl. That's a personal passion of mine. So I'm really, and actually what we're doing is we're getting the stories of fathers and families and how they've been impacted. So I'm really looking forward to
That's
that.
amazing.
Yeah.
Is that going to be, or is that primarily research, or like I'm thinking that would be an incredible anthology of literature,
Mm-hmm.
right?
Mm.
And that would be so one, and see, this circles back. This is where I get excited. One of the things that we know scientifically grows compassion, builds that compassion muscle, is literature, right? We know that neuroscientifically our brains, our synapses, when they are activated to put ourselves in somebody else's shoes, another character's shoes, to live in their world, our compassion grows and our capacity for empathy grows. And weirdly, you would anticipate that the more compassion we try to give other people, the more compassion fatigue we would have. But
Mm-hmm.
actually, it's completely the opposite. The more compassion we try to activate, the better we feel and the more compassionate we get. Right.
Wow.
So reading things like that not only is just reading a book, which is great for us, but it
Mm-hmm.
grows our compassion muscle. It activates that new part of the brain that allows us to be kinder to other people and take care of them, which is super cool.
Okay, we have to talk offline. We have to talk offline.
Okay. All right.
I'm super excited
Yeah.
because I have an idea, but that's okay. We'll have to talk offline for sure.
All right. Yeah, that'd be great.
Yeah, but have you read, this is kind of connected, but have you read Barbara Kingsolver's Demon King Kong?
Yeah, Demon Copperhead.
Demon
My copy
Copperhead.
is right here. I haven't read it yet, but it's sitting here waiting for me, and I'm so excited about it.
So I read it. My book club read it,
Okay.
and it is deep. You have to tell me once you read it, like how you feel.
Yeah, I'm
I mean,
excited.
but it tackles, of course, all of these concepts, and just takes you on this journey with this young boy. So anyway, that's really really exciting. Let's just kind of wrap up. We've talked a lot. We've talked about a lot of great things in terms of the awareness of what social determinants are, as it relates to health and inequality and inequity, I should say. We've talked about the importance of storytelling. I'm hoping folks, that you're going to the doctor, you're getting preventative care, you're educating yourself, you're understanding the importance of connecting with our neighbors, and we're all in this sort of together.
Mhm.
What can people be doing just every day? Let's just kind of peel away all of the lofty kinds of things that make people not want to do anything. And I get that. What are some things that we can be doing every day to help each other, to help ourselves?
Mhm. Um, so this is when students ask me the number one answer I give them is read, for the
Yeah.
for the reason I just said, right? Because it's like working out for your compassion muscle, right?
Mm.
So in the same way we should all be doing daily exercise as preventive care, we should all be doing a little bit of reading, and it doesn't need to be fancy, right? It can be like nerdy dragon novels.
Mm.
It doesn't matter to me. Whatever, it can be
Mhm.
kids' books.
Mhm.
But that actually improve. We know that reading also lowers our blood pressure and lowers anxiety, and so reading actually can improve your physical health, but also your compassion for others.
Mhm.
And so I think that's huge. But that individual exercise, dietary changes can help if you are in an area where access is a struggle. Just being observant about the amount of salt and sugar and things, those little things, right?
Mhm.
Um, Developing a concern for your neighbors, particularly in your area when the conditions change, right? So if you're in one of those places where the environment, it's going to get super hot, maybe
Mhm.
walk by that 90-year-old lady who lives next door and make sure she's doing okay.
Mhm.
So we are in a place where, as much as I hate it, our healthcare system is not built to protect us and prevent us from getting sick, right? Well, often people refer to our healthcare system as a sickness care system or an illness care system, right? We wait until we get sick and then we go get care. It's not there to keep us healthy. So we have to keep each other healthy and advocate for each other. Unfortunately, we shouldn't have to, but we do. So those kind of little things, I would say, strengthening connections to other people around you, community groups. Again, that's good for us psychologically and physically. It has outcomes, but also just allows us to strengthen that connection and that advocacy that we can all have for each other. The other thing is we can make individual choices for our biology, but again, it's those external factors. So yeah, you don't have to be the next, like, activists like down in your state's capital passing laws, right? You don't need to run out and get a law degree to change things. But maybe hit up a local council meeting to see if there's a volunteer group nearby planting trees. There is a national org that is now making an effort to plant trees in cities where there are big, hot spots.
That's good.
Or just like talk about it in your Instagram, right? I had this friend who did this cool project, had her high school students go out with disposable cameras and take pictures of how they feel like climate change is impacting their neighborhoods and changing their lives. And they took pictures and they posted them on their social media. And they had those discussions scientifically in her biology class, but the people in their lives got to see their feelings and thoughts about this, and that can change how other people think.
Absolutely. Wow. Well, Dr. Hume, thank you so much. This has really been it's been informative and enlightening, but also I just love the conversation. I love your passion around what you're doing. And I have a special heart, of course, for educators, because I know that passion is contagious, and I'm sure your students are taking that and you're, charging them with going out and doing their thing as well. So we really appreciate you for coming on. I'll definitely have to have you back. We'll talk offline about this project that I'm doing, and I'd love your insight and your help, because what I think it's going to be, again, I think it's going to impact everything that I do, especially now. I want it to go out to a larger audience of folks who are just like me, right? A daughter of Appalachia. And I want them to know, like, you can be better. We can do things to help one another. We can do things to help the client. So many people don't do things because they don't know what to do or don't feel like they can do something. But the reality is we can. So thank you, thank you, thank you. I'm going to take you off now, but I'll contact you so we can get back together.
Great.
Take care. Bye.
You too.
Wow. Thank you, Latasha. Thank you, thank you, thank you. I'm so inspired by that conversation. Health has always been something just personally that I've been interested in. Dr. Hume definitely gave me some things to think about. I know, of course, about the importance of green space and the importance of getting outside and eating better and things like that. But when you think about it from a larger perspective and you think about the disparity between communities where there are green spaces and communities that don't have green spaces, when you think about communities, as she mentioned, that are desert apartheid, meaning that there aren't easily accessible, healthy foods there. Like, all of these things are impacting us every single day, and they're impacting Black and Brown people at, much higher and certainly alarming rates than our counterparts. I'm bringing this conversation to all of us to raise our awareness, but also to call us to action, right? I know that a lot of times when I do lives, they are much more they're much more well attended because the topic seems a bit more sexy, or it's maybe delivered in a different way. But I specifically wanted us to have a conversation that would challenge us and call us to action. And when I say us, I mean everybody. We're all in this together. Health matters, right? It matters for you individually. It matters for your family. Many of you all watching, you're part of, a faith community. It matters for your aunties and your uncles and people that you are worshiping with. It matters, to the people that you're at the grocery store with, or you're at the gas station with, right? It matters. And it's so much bigger than, although this is important, it's so much bigger than, do I go through, drive through the fast food or not? That matters. Don't get me wrong. But there are bigger things that are outside of us, that are external to us. That does not mean, though, that we can't impact them. We just have to be aware of what those things are. If there's any aspect of what Dr. Hume and I talked about tonight that you're interested in knowing more about, inbox me, let me know. I also challenge you, look it up for yourself. Look up maternal mortality. Look up infant mortality. They're impacting more people around you than you know, right? My goddaughter just turned 16 years old yesterday. So shout out to Ayana Starks. She's a beautiful 16-year-old who is amazing in every way, straight A student, and is going to be a D1 track star. But when my best friend April was pregnant with her, she was having, it wasn't complications. There was something going on though with her in the hospital. And I was in the room with her. Her husband had gone home to get some rest. I was in the hospital with April. April goes, Matisa, I need you to get the nurse. And Ayana was born in an instant. Thankfully, all was well. She was fine. But as I reflect on that moment, I remember how startling that was, that my best friend was feeling weird, something wrong, something was wrong. And I was there to be able to advocate for her. How many women don't have an advocate? Or they're advocating and people aren't listening. We need to wake up, people. These are things that are happening every single day. People who are breathing in, smog and fumes from factories and those kinds of things. I know there are areas where large rates of people are coming up with cancer and other kinds of illnesses because of the toxic waste in the area. We're connected in so many different ways. So tonight's conversation really was to heighten our awareness and to call us to action. Can we make a pact together? I'm kind of going on my own soapbox, but that's okay because it's my show. Can we make a pact together that we're going to be much more health conscious, and not just for ourselves, but for people around us? Can we make a pact that, and I'm already thinking about, Dr. Hume was talking about planting a trees. Like, I'm going to look up that organization and I'm going to see how I can connect. What can you do? You can do something. Pick it and do it, right? That's my charge. That's the thing I want us to do. Make a pact to do something for yourself, but also something for someone else. Thank you so much for just being here tonight. I will be back next Thursday at 8 p.m. Eastern Standard Time. I'm telling you, we can move the needle when it comes to equity if we do something every single day. See you next week.